I am a believer that a breast augmentation should look and feel as close to a true natural breast as possible. And for that reason, I like to use gel silicone implants, which really have the consistency of a natural breast. It looks and feels most like our own tissues, and I think that's what most women are looking for. So, silicone. Over or under the muscle? That's a very good question. I do both, and the decision of which is the right choice for each woman depends on how much soft tissue she has, how much pinch that she has here to cover the implant. If a woman has enough pinch and her implants are of a conservative size, I will put the implants over the muscle. And I feel like in this position that the breast and the implant really move together as one structure and feel as close to a real natural human breast as possible. There are some women, however, who are very thin and they don't have enough pinch here. And in those women, we need an extra layer of soft tissue to hide the implant and create a more smooth transition. And in those women, I will go under the muscle so that the implant has a better camouflage. There is a belief that breast implants need to be changed every 10 years, and this isn't exactly true. The choice to have breast implants is one that requires a commitment to maintaining these implants over the long term. And there are reasons why a woman with breast implants would need to go back and have a second surgery to maintain them. And the reasons for revisional surgeries include things like implant rupture, capsular contracture, women that want to change of size, patients that have asymmetries or differences between the two sides. Some women have changes in their weight and they need to come back and have, a breast lift. So if we calculate the number of revisional surgeries for every woman who has breast implants, the average is one surgery every 10 years on average. But if everything's fine at 10 years, we don't actually need to change your implants as a matter of routine. What size of implants is best for each woman? And this is a question which perplexes every woman that's considering breast augmentation. And I don't think it needs to be that difficult. What I believe is that when we choose a breast implant, we need to choose one that's the right width for our breast, the right width this way. In the same way as when you go shopping for shoes, you need to buy a pair of shoes that's the right length for your foot. We can play with the amount of projection, how far the implant comes away from your body, in the same way as you can play with the height of a heel of your shoe, but we always have to respect the length of your foot. So using this sort of idea of the right dimensions for my patients, I take my patients through a sizing exercise at the time of their consultation, which is sizing using rice bags. That's my favorite technique. And I help them figure out what height of heel they like for their breast implants. Do they want something that's flat and close to their body, or do they want something that comes away a little further? And quickly get to a number which is the best number for their body. Now, I'll caution you not to spend a lot of time looking at the internet and saying, oh, that girl has a 300cc implant and I think she looks great, so that's what I want. It doesn't always translate. You need to choose the implant that looks best on your body, not the implant that looks good on a girl who you like on the internet. So go see your doctor, use different tools and tricks to figure out what implant is right for you, and you'll get to the size which is the best size for your body. Every surgery has risks and complications, and having a breast augmentation is no different. And there are reasons why a patient who gets a breast augmentation would need to go back to the operating room to have an issue addressed. In the early days, it's bleeding and infection. These are very rare, but they still happen on rare occasion. Later on, women will have to go back to the operating room because possibly her two breasts are not perfectly even. There's an asymmetry in the volume. She's not happy with the volume. She wants the implants a little bigger. She wants the implants a little smaller. There's a risk over the long term that if there's an implant failure or a crack in the implant, that we would need to replace them. There's a risk that the capsule or the bag of scar tissue that our body will lay down around this implant, if that doesn't evolve properly and starts to squeeze on the implant, we call that capsular contracture. That's another reason for a revision. And then there are some women that come back after a few years and need their skin tightened or a mastopexy breast lift in order to maintain their results. Breastfeeding is entirely possible after a breast augmentation. There's no reason why a woman shouldn't be able to breastfeed after having an augmentation. Whether we put the implants under her muscle or under her breast tissue, we're not interfering with the connections between the milk ducts and the nipple. There's a small chance that if you pass by an areolar incision that there could be some interruption in the drainage of the ducts, but not completely. So yes, the answer is you can breastfeed after breast augmentation. The presence of an implant will reduce the amount of breast tissue that can be seen on a traditional mammogram by somewhere in the range of 15 to 20%. So what I recommend to my patients is that they complement their routine screening mammography with an ultrasound, or even better, resonance magnétique, an MRI of the breast, which is really the best imaging technology for breast cancer screening and also to detect any problems related to the implant. The MRI doesn't need to be done at the same frequency as a mammogram. It can be done a little bit less frequently. What I recommend is every 5 years up until the age of 50, and then after 50 to have the MRI done every 3 years.